Hi, I'm Dr. Albert Nejat. Today we'll be discussing plantar fasciitis or heel pain. Traditionally, the heel pain used to be described as heel spur syndrome. However, over the years, it's been pretty much proven that the spur itself doesn't necessarily cause the pain. It's the plantar fasciitis that causes the heel pain. Patients come to my office with plantar fasciitis most of the time complaining of early morning pain. This early morning pain can resolve over time, but then later on during the day it comes back when they've been walking around or standing all day. The pain itself is caused from the irritation of the plantar fascia. The plantar fascia extends from the base of the heel to the base of the toes. As you step down and the arch collapses, the arch descends, the plantar fascia elongates in bowstrings, and the point at which where it does attach to the heel can get irritated. This happens mostly during middle ages, during the 40s and 50s, as we start to lose some elasticity to the skin and to the tissue. This loss of elasticity can account for increase in arthritis pain, increase in wrinkles. However, this pain needs to be addressed. One of the major treatments for this, if the person comes into my office and this pain is causing some debilitation, just walking into the office I can see that they're limping. By me pressing on their heel, I can actually make them jump out of their chair. Kind of cruel to do, but I need to find out how bad the pain is or how bad the irritation is. If it's that bad, I usually will offer a type of injection, a cortisone injection, an anti-inflammatory that's deposited into the area to reduce that inflammation. The anti-inflammatory cortisone injection is very effective over the short term. It reduces the pain, the inflammation. Patient gets back to walking and their normal activities within a very short period of time. However, some of the reasons why there is this irritation needs to be addressed. One of the reasons is obviously increased load down will increase that pull. So sometimes 5 pounds of weight loss is enough to reduce this. Sometimes wearing the proper shoes. If you have a job where you need to be walking on concrete all day, warehouse worker per se, that person needs to be wearing some sort of a rubberized shoe that has a good shock absorption. Also good arch support. We do recommend that people do an orthotic device that helps support that arch from collapsing. You can get over-the-counter orthotics or over-the-counter inserts from your local drugstore. However, that's sort of like getting your glasses from the local drugstore. They're not custom made, they're made for the masses, so they may not be 100% effective. If they are 100% effective, hey, you lucked out. However, if they're not made to fit, made perfectly, you may need something that is made to fit perfectly, and that's going to prevent that arch from collapsing too much. Prevention of that arch from collapsing will help reduce that load on the plantar fascia. Other treatments are taking a bottle full of water, putting it in the freezer. That frozen bottle can be used to roll back and forth. If you're sitting at your desk for 10-15 minutes, take off your shoe, put that frozen bottle on the floor, and massage the plantar fascia, and as well you're cooling off that irritated area. Other treatments can be calf stretches, because if the calf muscle is too tight, or the Achilles tendon is too tight, that's going to be pulling as a fulcrum on that plantar fascia even more. So continuous calf stretches, 3-4 times a day for a few weeks can reduce the pain of plantar fasciitis tremendously. So we've got your ice bottle, your injections, your calf stretches, your orthotics. Those are the mainstays of plantar fasciitis. However, some of the ladies out there may note that, I actually feel better with high heels. They're not that far off. Wearing 1 centimeter heel to 2 centimeter heel can actually reduce the pain of plantar fasciitis, simply because you're functionally elongating that Achilles tendon. If you're walking on a block, 1 to 2 centimeter block, the toes are pointing down, the heel is up, and that Achilles tendon is not pulling as tight, the tension on the plantar fascia is reduced. This is Dr. Albert Nejat from Los Angeles, California. If you have further questions, please contact us through our website, albertnejat.com, ALBERTNEJAT.com. Thank you.